So hello everyone and welcome to this case discussion series, case 22, and we'll be discussing one interesting case today. So here we have a 55-year-old male who presents with poor stream of urine and incomplete emptying of the urinary bladder. The ultrasound was done for this patient and there was prostatomegaly with some heterogeneous ecotexture. So hence MRI was advised, and whenever MRI is done for the prostate, it is multiparametric MRI, which includes T2 weighted images, DWI images, as well as dynamic contrast images. So this is the MRI picture done for this patient, and these are the T2 weighted axial sections which I'll be showing first, where we'll see multiple nodules in the central gland, that is transition zone, and the central zone, as well as the peripheral zone, with some ill-defined T2 hypointense intensity in the peripheral zone, the base. These are the coronal images, where again we can see that ill-defined hypointensity along with multiple large nodules in the central gland as well as the hyperintense peripheral zone. These are the DWI images, where we don't see any evident restriction in any nodule. These are the ADC images, where again there is no hypointensity that is seen. These are the post-contrast images. These are delayed images, where we don't see any abnormal contrast enhancement in any of the nodules. These are the coronal images post contrast, where again we don't see any abnormal contrast enhancement. There is of course intravesical prostatic protrusion of the hypertrophied median lobe of the prostate that can be seen, because of which the patient is having that incomplete emptying of the bladder. Intravesical prostatic protrusion is present. Irregular contour is there. Multiple nodules that are seen. So this is a report that I had given, that the prostate was grossly enlarged in size, measuring 82 cc with intravesical protrusion of the hypertrophied median lobe. So in any report of multiparametric MRI of prostate, the central gland consisting of the transition zone and central zone and the peripheral zones have to be described separately. So the central gland, the dominant sequence that we have to look for is T2 weighted images, while in the peripheral zones, the dominant sequence is the DWI images in the multiparametric MRI. So in the central gland, which consists of transition zone and the central zone, was grossly enlarged with multiple well circumscribed nodules with heterogeneous signal, which was compressing the peripheral zones as well. The nodules were very well circumscribed, which suggests benignity. A large, mostly encapsulated nodule of size approx 2.5 into 2.7 centimeter with heterogeneous signal was noted in transition zone. Whenever in doubt whether a nodule is benign or malignant in T2 weighted images in central gland, we go for DWI. So this particular nodule, which was mostly encapsulated, did not show any abnormal restriction on DWI, suggesting benign nodule of benign prostatic hypertrophy. Then coming to the peripheral zones, where the dominant sequence is actually DWI, an ill-defined area of moderate T2 hypointense signal, which was not very circumscribed, was seen at the base of the prostate, both on axial and the coronal images on the left side. But it did not show any differential restriction, again suggesting benignity. There were a few well circumscribed nodules with heterogeneous signal on T2 seen in the peripheral gland as well on both the sides, which did not show any obvious restriction on DWI, again suggesting benign etiology. Then there was no abnormal post-contrast enhancement that was seen in the nodules or the background parenchyma, which was suggestive of benign nodules of benign prostatic hypertrophy. The anterior fibromuscular stroma showed normal signal intensity on T2. The hypointense peripheral prostatic capsule, which is actually a pseudocapsule, was intact. Both the seminal vesicles and the neurovascular bundle at the 5 o'clock and the 8 o'clock positions were also normal. This is the impression that I had given, that there was grade 3 prostatomegaly with multiple nodules of benign prostatic hyperplasia in the central as well as the peripheral gland of the prostate, suggesting PIRADS 2. What exactly is PIRADS? We'll come to that. There was severe intravesical prostatic protrusion as well that was seen because of the hypertrophied median lobe. This is the basic anatomy of the prostate gland, which consists of the transition zone, the central zone, and the peripheral zone and the anterior fibromuscular stroma. So this is the base of the prostate. This is the mid gland, and this is the apex of the prostate. So base, mid gland, and apex. The peripheral zone actually goes on increasing as we go from the base to the apex, and it is present mostly in the lateral end and the posterior end, and on T2 weighted images it appears T2 hyper intense, homogeneously hyper intense, as we saw. The central gland, consisting of the transition zone and the central zone, it is present in the periurethral region, and it is present centrally within the prostate gland. The anterior fibromuscular stroma occupies a very small region, and it does not contain any glandular tissue. So the carcinomas usually exist in the peripheral zone, while the benign prostatic hyperplasia nodules usually involve the transition zone and the central zone. So this is the PIRADS. For the peripheral zone, DWI and ADC is the dominant sequence, and for the transition zone, T2 weighted images are the dominant sequence. What we have to remember is, whenever in doubt, as in PIRADS 3, for transition zone, we go for DWI. For peripheral zone, we go for dynamic contrast images. So PIRADS, I have discussed in my video of PIRADS here in the YouTube channel, Radio Nerds. You can go through it once.